Victoria Atkins, Michael Gove says this morning that you're going to stop talking to extremists. Last week, the Chancellor couldn't give me the name of a single group or individual. It's a bit surprising because there are already 2 or 3 that I can name that the government doesn't talk to. Are we likely to see additions to this list this week?
Well, what Michael has been talking about is a continuation of what the Prime Minister said a week ago on the steps of Downing Street, namely that there are some people, sadly, who hold views that are contrary to the values that we hold as a country. And we should not allow those views to percolate through society or indeed allow them to try and change the way we as a society conduct our democracy, the way we allow Parliament to set its own rules and conventions and so on. And so Michael, as you will know full well, has taken a long-standing interest in this and is setting out his ideas as to what we should do to tackle some of these very, very extreme views that we are sadly seeing expressed around our streets. But also, of course, people going... I mean, yesterday I saw somebody had ripped apart a painting, and you think this is not the way that we conduct democracy and express our views in this country.
Yeah, I want to come to yesterday a moment, but just let's be absolutely clear. What is it that the government is now aiming at? Are we talking about groups to which the government will not speak, or are we talking about groups who will be banned? Well, because it's quite a big step if we're talking about banning groups because of views they hold as opposed to things they have done.
Well, of course, we have a long-standing convention in this country of proscription for those groups that meet the very, very strict criteria under the legislation. That is, if you like, at the most extreme end. But also, I think there is, at the other end of the scale, there is concern that when, for example, we have demonstrations in London that, as happened yesterday, there is concern that with these large-scale demonstrations, there can be a minority of people who hold and extol views that make the rest of us feel not just deeply uncomfortable, but if you are a Jewish resident of London, some have said that they feel worried about walking around London when these demonstrations happen, and that's not right.
I understand that, and we've discussed that on this programme before, but we're talking now about, as it were, punishing or prescribing groups for their views. And you talked about long-standing traditions. I think we've got an even longer-standing tradition. I think the words Magna Carta come into my mind, which are about people being able and free to say what they think, even if it is objectionable, possibly even frightening to others.
And Trevor, you're exactly right to draw that distinction. And by the way, I hope I made myself clear when I was talking about the existing legislation, that is the proscription, as I say, under very strict criteria for groups of people who do or intend to do very real harm here in the UK and elsewhere. But and so that, as I say, is at the sort of extreme end of the range. But I do think we have to have a conversation about people behaving as they did, as I say, in this art gallery we saw over the last day or so, the demonstrations where people are projecting images onto Big Ben.
But it's a
delicate balancing act.
We have laws against that. It's called one called criminal damage.
Well, no,
not
actually, Trevor, forgive me.
What this is
that
really
wouldn't apply for the projection on Big Ben. That would not apply for the picture. Of course, it does. But we do also have hate crime. You're exactly right. We have hate crime legislation.
There's a suspicion that what's emerging here is really not, a noble defence of British values, but actually a new dividing line with Labour, because in essence, what you think is this is going to be really difficult for Labour because a lot of the groups involved here would be Islamist groups, and you think that that will give Labour trouble with its Muslim voters.
I fundamentally disagree with that. Our Prime Minister is a principled man. When he spoke on the steps of Downing Street, he spoke, I thought, with a great deal of personal conviction as well about the pain that racism, that ideology, extremist ideology can have, and that is absolutely totally not why we are trying to tackle these ideas. It is precisely because we have seen, sadly, in the last 6 months or so, we have seen this rise in extremist ideas, which is making people, other citizens in our country feel deeply uncomfortable. And so it is that balancing act between, as you say, the freedom of speech, but also the right of citizens to go about their daily lives.
Forgive me, we haven't got that too much time. I want to bring you on to, I guess, the big issue of the week, which is the budget. Every minister I've interviewed here in the past few years has declared himself or herself a tax cutter. How is it that a party which is going to raise the tax burden to over 37%, the highest it's been since the Second World War, has the gall to tell us that it's a tax-cutting party?
Because that's exactly what we've done, not just in this budget, but also in the previous...
Put taxes up.
Trevor,
7 million people will be dragged into a higher tax band by 2029.
Let me just give me a moment just to unpack this. So in this budget and in the autumn statement, we have provided cuts to national insurance for some 29 million workers. What that means is that someone on the average salary of, let's say, £35,400 will see a tax cut of up to £900 in their pay packets. That matters because that will make a real difference to the nurses, the hospital porters, the receptionists and other people who work in the NHS. But it is also important because it shows that we know that the last couple of years have been tough. They've been very tough because we spent £400 billion looking after us all in the pandemic and with the cost of living pressures arising out of the war in Ukraine. But we as Conservatives believe that we have to deal with that debt ourselves. We do not want to pass that debt onto our children and our grandchildren, which is why we had to make some very difficult decisions. But we've done this whilst also protecting day-to-day spending in the NHS.
Forgive me, I get all of that, but your person on 35,000, they'll get an inflation increase and they might get a little promotion and suddenly they're into a 40% tax band. So you've given them a bit on national insurance, but actually, by freezing the thresholds, you're actually taking more from them. And in fact, what we know is you're getting an extra 7 billion or so, but actually you're taking, because of the threshold freezing, something north of 20 billion a year. Now, why not be level with us?
Well, in fairness...
For the reasons you just given, probably the government needs more tax revenue. Why not just be straight and say, we're taking more money from you?
So, Trevor, in fairness, I was Financial Secretary to the Treasury when we had to make that very difficult decision about thresholds, and I was completely straight every single interview I did about that. And we do not resile from that. What we're saying is that our conviction that we cannot pass these debts on to our children and our grandchildren still stand. But we want to help reduce taxes in practical ways for people who are working, and we've achieved this not just in the spring budget, as I say, but also in autumn statement. And we have done that without borrowing, without reducing spending across departments. And so we have here a budget that has delivered a tax cut whilst also protecting, as a health secretary, day-to-day spending on the NHS, and importantly also dealing with high-income child benefit, which I know many of your viewers have felt very strongly about. We're trying to reduce that so that fewer people are caught by that, and we make it fairer for those families that have single incomes.
Let's just spend a minute on your own specific area of responsibility, which, of course, does have an impact. The biggest break on growth, I think the Chancellor's acknowledged, is that over 9 million working-age adults are off work because of sickness, and about a third of those are off because of some long-term illness, and particularly mental health. 3 million or thereabouts on incapacity benefits. What are you going to do about that as Health Secretary? Surely you've got a contribution to make here in getting people back to work.
Very much so. And as we've always said in the past that a strong economy helps pay for the NHS, I also think actually a strong and productive NHS supports a growing economy. And as you've set out in the figures, we have to try to encourage people back into work. Now, the Prime Minister...
What are you going to do to make it worth their while? Because actually They clearly don't feel they have to go back to work.
Well, so as the Prime Minister has set out today in an interview in one of the Sunday papers, we want to tackle the increase that we've seen over the last decade or so of people being able to sign off long-term sick when they may well be living with conditions that we can help. You know, if we can help look after those conditions with them, then they will be able to return to work. Of course, there will always be people who need help and cannot return to the workplace, but we want to encourage people back.
I saw that interview, and I noticed the Prime Minister says that what his aspiration was, but he hasn't said how. Is it your plan to make it tougher for people to claim that benefit?
Well, we want to, I as Health Secretary, I'm looking into how we can change the conversation from getting a sick note to getting a fit note. So changing this emphasis that somehow musculoskeletal conditions, for example, which is a very common reason for people being signed off sick, that means that you can't do any work whatsoever. Because we know not only does work have financial benefits for us, it also is important for our well-being. It can help with our mental health, it can help with recovery. And so there's a huge amount of work that Mel Strider is doing in the Department for Work and Pensions on this, but as Health Secretary, I really want to help him. And through the productivity plan that the Chancellor announced at budget, some £3.4 billion invested into the technology, that's going to help us with some of these big issues facing the whole of the state, not just the NHS.
I get that. Can I just ask you one last question, which is, I guess, a straightforward one as a woman parliamentarian. The big news of the week is that Theresa May has decided that she's not coming back after the next election. She opposed All Women Shortlist, but she was a sponsor of the Conservative Women to Win campaign. You've got 88 female Tory MPs now, but that's actually a quarter of your total compared to Labour's 52%, half, which came about largely because of All Women Shortlist. Was Theresa May right?
Well, first of all, can I pay tribute to Theresa? It has been an absolute privilege to work with Theresa, not just when she was Prime Minister, but also the work she's continued since then, including in topics such as domestic abuse. We brought forward, of course, the Domestic Abuse Act, and Theresa, as Prime Minister, was critical in driving that forward, but also her work surrounding diabetes as well. So she will be so sorely missed. In terms of Women to Win, I should declare an interest. They helped me into politics. And we've always, as a party, we've always been cautious about All Women Shortlist because we think actually we can make real progress. And I've been meeting some of the female candidates we have coming forward for the next election. They are brilliant, and I really look forward to welcoming them to the green benches in the House of Commons.
Victoria Atkins, thank you so much for your time this morning.
Thank you.